Hi everyone. I get questions from time to time on indirect bonding and how it works from lab techniques all the way through to chairside. So I asked Dr. Graham Jones, one of our clinical advisors, if he would record some video in his office of how he does indirect bonding, what process he follows, and what products he uses. So what you're about to see here is his chairside protocol for an indirect bond. You'll see the patient and technician interaction as well as all of the products that he uses. So I hope you enjoy. Thanks.
I'm going to polish your teeth, get them nice and clean for the bond to be really strong. Okay, now I'm going to give you a rinse out. Good and close. Our little cheek pillows that are going to keep things dry, okay? I put them in the sides of your cheek, and then I'll put the cheek retractors in, so it'll be a little bit of a stretch first, okay? Okay, and now bite together a little bit more, right there, very good. All right, and I'll have you bite even more than that. Right there, great. Does that feel all right? Okay, very good. A lot of air on your top teeth and put your upper braces on first, okay? So this is just air. Then I'm gonna paint a blue gel on your teeth for about 30 seconds, and then I'll rinse it out. I'm gonna have you turn towards me a little bit. There you go. It all off, okay? And then we're gonna rinse it all. Lola, can you look towards me just a little bit? Thank you. You're doing a great job. All right, nice and clean. Now I'm gonna paint a gel on your teeth, okay? This is Pro Seal. gonna shine a light on your teeth. On each tooth.
Okay.
Alright, now I'm going to put one coat of our sugar. Two coats on the second premolars. Those ones didn't get Pro Seal on them. A little bit of air. Throw a little bit of air to thin that assure. And then we get ready to put the braces on. So now place the tray onto your teeth and shine a light. 5 seconds each tooth. And then I go back around again and do another 5 seconds. Alright, so when we are done curing the tray, then we're going to take the plastic piece off through your teeth, okay? It just peels right off, Lola. I'm just going to go like that. Sometimes it does tear at the occlusal, and that's easy to just take right off. Yeah, good job. Just like that. And then I always like to give it another little light here all the way around. And voila, you have upper braces. Pretty easy and quick, wouldn't you say? Good job. Like that, okay? I'll be able to work around it. This section open just the tiniest bit. Very good. A little air here. Wonderful. I'm gonna paint that coat of our shirt on more, premolar. And then bite down for me on that all the way. Good job. And keep your tongue back still. Yep, you're good. You can bite all the way down on that. Great job. I know that other side's kind of floating there. I will get it in just a second. You're doing a great job staying still. Okay. Then I'm going to blow a little bit of air on those areas. I'll have you open just a tiny, right there. Yep, not too big. Bite down. Yep, good job. is my last coat of a shirt on every tooth down here. Tray out of the orange curing box, and then I'm going to have you slowly open just the slowest. Yep, very good. Don't open any more than that. I'm going to put the tray in. Very good. And then I'm going to grab the curing light and cure each bracket for 5 seconds one way, and then we'll go around again for 5 seconds on each bracket. I like to start curing in the posterior, the back of the mouth first. Great job. Alright, so we're done curing the brackets. Now we're going to take the tray off. Good job, Lola. Let's put this right off. And you can close just a little bit, and then I'm going to shine a light over the top just for good measure. Pray that gets stuck around, okay? So I'll give you a napkin that you can pick some out if it gets on your tongue. But we can fold around a little bit. Stick your tongue out. Thank you. You'll be fishing for them. Alright. Okay, wonderful.
Okay, everybody, so that was your front row seats to Dr. Graham Jones and his chairside protocol for indirect bonding. I hope you find that helpful. As always, if you have any questions, please let me know. Happy to help. And keep in mind that was the protocol and the products that work well for him, not to say that another doctor doesn't do it differently, but I wanted to give you guys an example of what that might look like. All right, thanks.